Hi, I'm Chris Skamansky. I'm a biostatistician. And so today I'm going to be talking about my career as a statistician. So I graduated from UD in 2007 with a Bachelor's of Science in Mathematics. Afterwards, I went to the University of North Carolina at Chapel Hill, where I received my PhD in statistics. After that, I did a postdoc research position for 2 years at Washington University in St. Louis. And then I moved out to San Francisco and have been in the pharmaceutical industry since then. So I spent a few years at Genentech, and most recently I'm currently working at the Parker Institute for Cancer Immunotherapy, which is a nonprofit which is working on cancer research. So one question I commonly get asked is, is there a difference between a statistician and a biostatistician? And the short answer is no. So those of us typically in the field, we use the two terms interchangeably. If you're looking at graduate schools, they may have both a stats department and a biostats department. And in fact, UNC, where I did go to grad school, did have both of them. I was in the stats department, which was in the College of Arts and Sciences. And then there's also a biostats department in the School of Public Health. There's a slight difference in the type of classes you're taking, but overall, if you kind of get your PhD in one, you can do the same sort of career opportunities as if you had gone to the other program. So they're more or less equivalent. It's just maybe with biostats, you're a little bit more focused on biological applications of the data, where the stats department might be a little bit more broad and maybe a little bit more focused on theoretical applications. So what is my vocation? What really gets me excited to get up in the morning? So I really like to use statistics and pair that with strategic thinking on drug development and how can we develop new drugs and get them to patients in diseases where there really is no good treatment. So one of the current diseases that I'm working on is pancreatic cancer. So we've had a lot of celebrities recently, unfortunately, die of pancreatic cancer just because there really aren't too many good treatments out there. So we're trying to think about how can we develop and test new cancer treatments to help these patients live longer. And so what I do is I mostly focus on clinical trials. And so I help start up the study. So not only do I do sample size calculations, but I think about, do we want to have the randomized study? Do we want to blind the study? Also thinking about, what is our goal of the study? What is our hypothesis? Are we mostly focused on safety of the drug? Are we mostly focused on the efficacy? So seeing whether it actually works. Or are we looking at a combination of both of those? I'll also go through and determine what statistical analyses we're going to use. So when we calculate p-values and confidence intervals, are we using z-tests, t-tests, or maybe something more complicated? Then when the data is collected and analyzed, or collected, I help to analyze the data, and then I help to interpret the results. And it's really exciting because oftentimes the statistician is one of the first people, if not the first person in the company that gets to know whether a treatment actually worked or not. So did we get that significant p-value or not? And so I just went through this in one of the clinical trials in pancreatic cancer, actually. And so it spent 3 years. The trial was 3 years long, millions of dollars. We were testing 3 different cancer therapies in about 130 patients. And it was really exciting that I got to crunch the numbers first, see the results first, determine if any of them were positive or not. And then I got to present that data to our management team and also to some of the investigators, so the doctors who were enrolling patients onto the study. So it's been a very busy week, but a lot of fun and exciting conversations that I get to be a part of. So what makes a statistician successful? So I think, especially if you go to grad school, and you have your PhD or you have your master's degree, really what distinguishes a good statistician, I think, from a great one is if you're able to understand the data sets that you're working on, right? So you don't want to just be crunching every single data set just for p-values. You have to really be challenging people when they come to you with data sets, or if they ask for your help with designing a clinical trial and getting to the root of what actually is the hypothesis that they want. They may say something, but then if you dig a little deeper, you find out, no, they actually want to do something else. Letting them know if they have something in mind, if the trial that they have planned or the data set that they have in their hand, is that actually going to help you answer that question? And sometimes it's no. And then you have to explain that and figure out other ways around the question and how maybe you can better get at that. And so there's a lot of creative thinking. There's a lot of strategic thinking also too. When you're in industry, you may have an idea of getting a really good answer, but it would be a very expensive experiment that you just don't have the money to do to run that experiment. So how can you do and get by with smaller numbers of patients with shorter follow-up on some of these trials than you would ideally like? So it's a lot of kind of give and take. And so it's more than just black and white statistics and numbers. It's a lot of strategic thinking, which is really exciting. And what's also fun too is it's really a team effort. And so I work alongside immunologists. I work alongside other people with biology or chemistry backgrounds. I work alongside physicians. And so from them, I get to learn a lot about the disease types that we're studying. I get to learn about the specific drugs that we're testing, like how that actually is supposed to be working in your body. And so it's really through all my conversations with them that I've learned so much about different cancer types and treatments and T cells and B cells and all these other type of cells that I never learned in school. But now that I'm in the classroom, or not in the classroom, out of the classroom, but now that I'm working alongside these people, I get to just ask them these questions, these experts in these fields, and they help me along. So it's been a great on-the-job learning experience. You really don't need to know biology to become a biostatistician. You just need to be curious to learn that. So when the opportunity presents and you're dealing with data sets, that you have to be curious enough to learn about it. So the last bio class I took was actually in high school. I didn't even take any in undergrad. But yet here I am, a biostatistician, and hopefully I would like to think a pretty successful one. So as long as you have that curiosity and willingness to learn, you know that statistics is your kind of backbone, but then you can apply it to other areas. And that also provides you some flexibility. So if you start as a statistician or biostatistician, you can pivot to other industries or fields if you're interested. So if you all of a sudden got recruited by a tech company to work on self-driving cars, with your stats background, you could learn the science behind self-driving cars and what you needed to do, even if all you knew was cancer. So it's really having that adaptive mindset and willingness to learn that's really gonna make you successful in your career. I think the easiest path to become a biostatistician is to go to graduate school. So either a master's degree or PhD. At the end, I work alongside both. The PhD, you just start at a higher level. Then if you're a master's, it might take you a little bit longer to work your way up, but both are doable. And to be prepared for graduate school, you definitely want to take courses like real analysis to prepare. So they don't look so much at the stats courses you've taken, although I recommend you take as many stats courses as you can. It's really the analysis courses, because a lot of your coursework in grad school is going to be abstract and theoretical, similar to real analysis. So you need to have that strong theoretical background, which UD definitely prepared me for grad school with that. So that should be where your focus is if you're thinking about grad school. But then after you get through those more theoretical courses in grad school, then that's when you get to do your research or thesis, and that's when you can pick a specific area to focus on and get hands-on with real data. If you're unsure of grad school, and I definitely was as an undergrad, I would really suggest reaching out to one of your math professors and asking them about research and what is math research. For me, it was Dr. Higgins, where I had these conversations with, and she was great with letting me try out some research. And that's what really sparked in me that, hey, grad school and research isn't that weird of a thing to do, and that I actually enjoyed it. So had it not been that trying the research in while I was at UD, I don't think I would be here, but I'm very grateful for that. So if you have the opportunity, I would highly recommend that you try doing some sort of research at UD. And then the last thing I want to finish with is realizing that there's more than one way to get here. So in the department that I work at, we're all computational people. We do slightly different things, so they don't have the title biostatistician, but we're all working on cancer data. We're all doing computational statistical analyses, but they have backgrounds such as PhDs in applied mathematics and immunology and computational biology, engineering, or epidemiology. So even though there's kind of maybe a lot of different ways you can go in the next few years, especially if you want to go into grad school, realize that at the end, they may all converge back again. So it really goes back to, where you want to be in the future, what you find interesting, and then no matter what your major is now or what you're going to be going into in grad school, just keep working out what you're interested in, what you find interesting, and then you'll be able to find a career, no matter what the specific degree is that's on your resume. So I'm going to end here, but I'm happy to talk to anyone who's interested and has additional questions. So you can either connect with me on Flyer Connection. I do have a profile set up there, or I'm also available on LinkedIn. So I hope this was a little bit of insightful into my life as a biostatistician. I'm definitely very passionate about it and love what I'm doing, and would love to chat with you guys more if you have any questions. Bye.